Hi, I'm Dr. Luke Pogue, and today we're going to talk about why I do not recommend sleeping pills for insomnia. Insomnia is a very common condition, and many of my patients experience it, and many of them ask me for help with their insomnia. Some, but not all of them, expect a sleeping pill when they talk to a doctor about insomnia. That is, after all, what we do, right? We prescribe medications. But it turns out that's not the best, or even nearly the best, approach to insomnia. In fact, I almost never feel like sleeping pills are appropriate for insomnia, and there's basically two reasons. Both they're not safe and they don't work. And the third reason is there are effective and safe ways to treat insomnia, which we'll talk about in another video and toward the end of this video. But as far as the safety, sleeping pills cause a lot of problems. They can cause car accidents. In fact, women's maximum dose of a certain commonly prescribed sleeping pill was reduced 5 or 10 years ago because of car accidents that were found to happen at the higher dose. Even at the lower dose, car accident rate and your reflex time, even if you're not feeling sedated the next day, it's been shown that your reaction time and car accident risk is higher. And that doesn't even include the sleep driving that can happen. Sleep driving, sleep eating. The patients have told me that they realized they had gone for a drive in the middle of the night that they don't even remember after they took the sleeping pill. People have reported repeatedly finding empty ice cream containers in the garbage that they had eaten excessive amounts of ice cream that night, and certainly don't want to cause more problems with obesity and diabetes running rampant in our culture. So obviously those kind of problems are significant. And more seriously, even the death rate goes up significantly, 3 to 5 times that of people who don't use sleeping pills. So even if you use sleeping pills occasionally, your rate of dying in a British Medical Journal article in 2012 was 3.5 times that of people who don't use sleeping pills at all. And the speculated reasons for this are not only one. There's probably more than one reason, but it's thought that depression and anxiety were more common in sleeping pill users, and those can lead to troubles that lead to death. Even cancer rate was found, independent of smoking. Cancer rate was 20 to 99% higher, depending on the type and dose of sleeping pill and the type of cancer, in people who use the sleeping pill. So certainly don't want to increase cancer risk. It was estimated in that study that there's 500 million deaths per year that could be attributed directly to sleeping pills. So, in terms of first do no harm, it seems obvious that we would not want to use a medication like this, especially because, my second reason I don't want to prescribe this medicine is because it doesn't work. On average, it gets you to sleep about 8 minutes earlier than if you weren't taking a sleeping pill, and it's never been shown to improve quality of sleep, or REM sleep, deep sleep, and the next day performance, cognitively and physically, has never been shown to improve with sleeping pills. So I always try to get patients to realize that it's not that I don't want to help you, it's just this won't help you, and it may hurt you. So we don't want to use a medication like that. And the third reason I don't prescribe them is because there are safe and effective ways to treat insomnia. They take more time. It may be easier for doctors to just write a prescription. It takes less than a minute to write a prescription, but it might take some time to talk about healthy sleep habits and dealing with stress. And it may take some cognitive behavioral therapy has been shown to be helpful through psychologists, but just healthy sleep hygiene habits and a technique I call sleep restriction are very helpful ways to treat insomnia, and you can learn more about those in my videos about sleep hygiene and sleep restriction. So that's why I don't want to recommend sleeping pills for my patients, and I hope you have a great day and a great night's sleep. Thanks.